Hello, my name is Darthula Young, and our first training is going to be getting familiar with advanced care planning. Community health workers play a crucial role in promoting health and well being within their communities. Equipping CHWs with knowledge and skills related to advanced care planning, sometimes called ACP, empowers them to effectively guide individuals and families in making informed decisions about future medical care. In the first section of this training program, we will review several fundamental concepts of medical decision making in general, and then move into the process of planning for medical decisions that they may need to make in the future. This video will explain patient autonomy, explore circumstances that impact medical decision making, describe the importance of goals of care, introduce advanced directive documents, and emphasize reasons for talking to others about future healthcare decisions. Our first topic is patient autonomy, centering medical decisions around the patients. One of the fundamental rights of all patients in the American healthcare system is the right of people to make decisions about their own body based on their own values, beliefs, and goals. In the area of healthcare, this right is called patient autonomy. Patient autonomy ensures that individuals have the right to actively participate in decisions about their own health care based on their personal values and preferences. It also requires that people can make decisions that are well informed by professional advice from a healthcare provider who is treating them and understands their medical conditions. Patient autonomy is a critical component of ethical medical practice, promoting respect for the individual and their right to control their health and well-being. The concept of patient autonomy is central to providing quality health care because it respects individual values and beliefs. Patient autonomy acknowledges that every patient has unique values, preferences, and goals for their life and health. It respects the diversity of people's backgrounds and beliefs and promotes individualized care that aligns with the patient's desire. Additionally, it promotes trust in healthcare. When healthcare providers respect patient autonomy, it fosters trust between patients and providers. Patients are more likely to feel empowered, supported, and involved in their healthcare decisions, which can increase their willingness to follow instructions about medications and treatment and improve overall satisfaction with care. And finally, it improves decision making. Encouraging autonomy means involving patients in the decision-making process and providing them with the tools and information they need to make well-informed choices. This leads to care that aligns well with the patient's lifestyle and desired outcomes and can reduce feelings of helplessness or loss of control, particularly in serious medical situations. There are limits to direct patient autonomy. Sometimes patients are not able to communicate well enough with their medical team and cannot safely make decisions about their own health care. This can occur for many reasons, including because the person is in a coma, under anesthesia during surgery, or has cognitive impairment due to a temporary infection or due to permanent dementia. This condition is called a lack of capacity. It occurs when patients lack the mental or physical ability to make informed decisions, and decisions need to be made by someone else. The person who steps in to make decisions on behalf of a patient who lacks capacity is sometimes called a legally appointed substitute decision maker. There are several kinds of substitute decision makers to be aware of. The first is a healthcare surrogate. This is an appointed person who is usually a close relative. The second type is a power of attorney for health care. This is a person selected beforehand by the patients themselves to make medical decisions when necessary. The third is a legal guardian. This is someone appointed by the state where the patient lives. If a patient requires medical attention and a substitute decision maker cannot be reached quickly, then the patient will automatically receive what is called the standard of care. This care consists of the medical treatments that the healthcare community has determined to be the standard treatment required to stabilize the patient's condition until the substitute decision maker can be identified or located and begin making medical decisions about the patient's care for as long as they lack the ability to make decisions for themselves. Our second topic is about how much circumstances matter. The truth is that thinking about what medical care a person might want in the future while they are experiencing good health and well-being in the present moment can be difficult. Advanced care planning means thinking about, talking about, and making future medical decisions. Advanced care planning can be challenging because it involves predicting a variety of possible situations and matching choices about future medical treatment with personal values, medical information, and other considerations. In this section, we will examine some important concepts that influence the success of advanced care planning. First, let's talk about the uncertainty that exists about the future and a person's health and well-being in that future. Illness is often unpredictable. It is difficult to know ahead of time what the journey will be like when a person is diagnosed with certain diseases, or to know when a new health condition might pop up. While someone may plan for specific scenarios, such as a terminal illness, unexpected health issues may arise that weren't anticipated by the medical decisions they have made in the past. Furthermore, the medical and functional needs a person has doesn't remain the same. How healthy or sick a person is can change over time, making it hard to account for every possible future medical decision. What might seem like a clear choice now may be complicated by a new diagnosis or the availability of new medication and technologies to treat an existing illness in the future. Yvette's story is a good example. Yvette is an 81-year-old woman who has melanoma skin cancer that has spread to other parts of her body, but she is successfully managing the cancer with medication. She has decided that if her cancer starts growing again, she does not want to have chemotherapy because it would make her sick and reduce her quality of life. But then Yvette begins to experience an irregular heartbeat that is not related to her cancer. Her heart doctor recommends that she have surgery to prevent her heart from stopping suddenly. After talking to her pastor and her kids, Yvette decides not to have surgery because it would be disruptive to her life and might have complications. She is willing to risk dying suddenly because she views eventually dying slowly of her cancer to be a worse way to go. Next, let's consider the difficulty in anticipating what medical preferences a person will have in the future. Research has shown that people's perspectives about their health and well-being don't say the same. A person's view about their own medical care, especially during a long-term serious illness, may evolve with time, age, and life experiences. What a person may want in their 40s could change dramatically in their 70s. It is very hard for people to envision what their lives would be like in future states of health. Many people find it hard to imagine themselves having a critical or terminal health condition, making it challenging to know how they will feel about certain treatments, such as life support and feeding tubes when faced with those realities. Think about this story involving Jack. Jack was an active, energetic man his entire life. At age 50, he thought he knew that he never wanted to be dependent on other people or be tied to a piece of medical technology. When Jack was first diagnosed with ALS at age 53, he told his family that if he lost the ability to swallow, he did not want to have a feeding tube surgically placed in his stomach to provide him with nutrition. But 3 years later, Jack had adapted to many changes in his body. He was reasonably comfortable using a wheelchair and other assistant devices. He considered his quality of life acceptable and was looking forward to the arrival of his first grandchild. So when his neurologist told him that a surgically placed feeding tube was going to be needed because he could no longer swallow food safely, Jack agreed and adapted to having his wife administer artificial nutrition through the tube twice a day. Jack now says he is happy he will live to meet his grandson and participate in life as fully as he can. As you can see from the two people described in our stories, decisions about healthcare can change over time. Now, what would happen if someone else needed to make decisions on behalf of Yvette or Jack? Would they know what to do? It's important to consider the differences between stable healthcare preferences, which are choices about future healthcare that are unlikely to change over the course of someone's life, and unstable healthcare preferences, which are choices about future healthcare that are likely to change over time as the person's health and well-being changes. The differences between stable and unstable healthcare preferences reflect how consistent a person's choices about their medical care remains over time, particularly in relation to future treatments or care decisions. These preferences are influenced by factors such as personal values, experiences, health status, and emotions. Here's how they differ. Stable healthcare preferences remain relatively constant over time, even as circumstances change, making it easier to do advanced care planning. A person's stable preferences are usually based on a strong and enduring sense of what they want regarding healthcare treatment, perhaps because of religious or cultural beliefs, and these choices are less likely to shift due to external factors or new information. Because stable preferences don't change often, advanced care planning around them can provide clear and predictable guidance for healthcare providers and family members, especially when making decisions during critical situations near the end of life. In contrast, unstable healthcare preferences change over time, often due to the situation. Is the person's health getting better or worse? Does the person feel emotionally better or worse about their health? What new information or research about the person's illness and its treatment becomes available? With unstable preferences, flexibility is very important regarding future decisions guided by advanced care planning. Because these preferences may change and conditions and information change, they should not be set in stone, but instead be guided by an understanding of the goals, priorities, and concerns expressed by a person over the course of their life or illness. In the next session, we will explore ways to allow for flexibility and changing circumstances like what happened to Yvette and Jack. Our third topic is goals of care and the importance of talking about what matters most to each individual person. Goals of care are a central concept in advanced care planning as they help align medical decisions with a person's values, preferences, and desired outcomes, particularly when facing serious illness, chronic conditions, or end of life situations. Defining a person's goal of care involves discussing what matters most to a person regarding their health and quality of life. Thinking about what brings a person comfort and enjoyment and what makes them worried and uncomfortable can inform decisions about medical treatments in the future. What exactly do we mean by goals of care? Goals of care refer to the desired outcome a person hopes will happen through medical treatment. Goals of care conversations are sometimes initiated by their healthcare provider and can relate to a person's health, their well-being, and their physical and mental functionings on a day-to-day basis. Goals of care answer the question, this is what I hope will happen given what is true about my illness or injury. Here are some general examples. Prolonging life or delaying death by using aggressive treatments to extend life for as long as possible. Or maintaining or improving function by focusing on treatments that enhance the ability to live independently and carry out daily activities by themselves. Or returning to a previous state of health by focusing on treatments that offer a reasonable hope of returning to a level of health or functioning that existed prior to an illness, accident, or other temporary medical problem. Or emphasizing comfort by focusing on minimizing pain and other discomforts, even if it means foregoing death, delaying treatments. How do goals of care fit into advanced care planning? As a person's health changes, their initial goal may no longer be realistic. Having ongoing conversations around goals of care is important in ensuring their preferences about future treatment matches with their goals. Advanced care planning helps to discuss and document these preferences in a way that guides future medical decisions that may need to be made by someone else. Let's look at some examples. Discussing someone's goals of care in relation to a future situation helps them clarify their priorities, such as maintaining independence, avoiding prolonged suffering, or having a peaceful death. During these conversations, people reflect on what quality of life means to them, which can inform the way people close to them think about their future medical goals and decisions. For example, Leroy has come to terms with the fact that his AIDS diagnosis will lead to death within a year. Leroy knows that staying at home rather than being hospitalized is important to him, even if it means receiving fewer aggressive, life-sustaining treatments. This goal can guide him to express a choice in favor of home-based hospice care rather than returning to the hospital for aggressive care as his illness progresses. This will help Leroy's chosen family to make better decisions for him if Leroy is unable to make decisions for himself. A person's goals of care may change as their health changes. It is important to understand that advanced care planning is an ongoing process that allows a person's goals and choices about future care to be updated over time. As an example, Sue initially desires curative treatment for cancer so she can spend more time with her children. However, 2 years later, Sue may shift her wishes towards receiving comfort, focus, and supportive care if the side effects from the treatment makes her too sick to spend meaningful time with her children and family. Sue and her husband discussed this shift in her illness and adapt her planning accordingly. Having documented goals of care helps healthcare providers deliver consistent, patient-centered care regardless of where the patient is being treated, whether that is in a clinic, a hospital, or a long-term care facility. For example, Rosie suffers from heart and lung disease. She has been hospitalized several times, and following the latest hospital stay, she needed to go to a skilled nursing facility to receive rehab. Rosie has been able to bounce back in the past and feels strongly that she will be able to get better and go home. Rosie has expressed and documented to both the hospital and the nursing facility that she wants to receive all available treatment which aligns with her goals. So, let's summarize this section. Goals of care help families or loved ones to make future medical decisions about specific treatment options that the person did not necessarily think about or talk about, because they are based on who the patient is as a whole person. Goals of care and choices about future medical care are related but not the same thing. For example, no one's goal is to receive hospice or have CPR. However, understanding a person's values, joys in life, and concerns for themselves helps family members to determine what their loved one's goal might be in a given set of circumstances. Our fourth topic is about completing legal and medical forms. This short section is an introduction to advanced directives. In advanced care planning, the concept of goals of care is essential for guiding medical decisions in a way that reflects an individual's values, preferences, and definition of quality of life. These goals serve as the foundation for creating legal documents called advanced directives that ensure healthcare providers and families make decisions consistent with the patient's desires, ultimately ensuring that their medical care aligns with their broader values. Advanced directives are legal documents that allow individuals to outline their preferences for medical care if they become unable to communicate their desires due to illness or incapacity. These documents help ensure that a person's healthcare wishes are respected and provide guidance to healthcare providers and family members. There are several types of advanced directives that an individual can consider having. A living will specifies the type of medical treatment and life-sustaining care a person does or does not want. This can include decisions about resuscitation, ventilation, tube feeding, dialysis, and more. A durable power of attorney for healthcare designates another person to make medical decisions on the individual's behalf if they are unable to do so. A do not resuscitate order instructs healthcare providers not to perform CPR if the patient's breathing stops or if the patient's heart stops beating. And a physician's order for life-sustaining treatment specifies the types of life-sustaining treatment a seriously ill patient wants or does not want. This form is typically used for patients with serious illnesses or frailty. An additional advanced directive that will not be discussed in this training is a mental health treatment preference declaration. In part 2 of this training, we will dive deeper into 3 of these advanced directives documents. Our fifth and final topic is sharing decisions with people who matter, because writing down future healthcare preferences in advanced directive documents isn't enough. Many people prefer to keep their legal documents private. With end-of-life issues, however, communicating about a person's wishes is essential. An advance directive is one step in this process, but it's also critical to discuss goals of care and treatment preferences with others, especially with the person appointed to make decisions in an emergency. Everyone should talk to their regular health care provider and make sure the people who are their given or chosen family know their wishes about end of life issues. It takes courage for people to talk about their expectations for well being and quality of life, especially when someone has been diagnosed with a serious illness. Of course, it's completely natural to hope that a loved one's illness gets better or that their health doesn't get worse for a long time. That's what everyone hopes for. But it's also important for family members or close friends to understand the wishes of their sick loved one in case the illness doesn't get better. Serious illness is defined as a health condition that carries a high risk of death and either negatively impacts a person's ability to function normally or reduce their enjoyment of life significantly. A serious illness might result from a sudden accident or from advanced illness like cancer or heart disease. It's best to start having conversations soon after a diagnosis or when the illness has become more serious. It's equally important to have another conversation when any changes occur with the person's conditions. Waiting until a medical crisis occurs makes communicating and decision-making more difficult. In these situations, the people involved may be tired or upset and not in a good place to make the best choices. Stress and anxiety are unavoidable, but when everyone involved understands how the patient wants to live their life and what is most important to them, stress and anxiety can be better managed. First, it's important to have discussions between patients and family members or other important people in the patient's life. It is important to discuss not just what a patient's decisions are, but also why. Discussing goals of care as part of advanced care planning encourages clear communication between the patient and family members or close friends and ensures support for the patient's decisions when they can no longer express their wishes. Having discussions ahead of time avoids surprises. A medical emergency or trip to the hospital is stressful for everyone. Sharing goals of care in advance helps avoid misunderstandings and ensures that everyone involved in the patient's care understands their wishes before they need to be respected. These discussions also improve acceptance by loved ones around decisions the patient has documented in their advance directives. A family may be more prepared to accept a decision to stop curative or extensive treatments if they understand that the patient's goal is to focus on comfort and dignity at the end of life. Secondly, communication between patients and medical providers during a serious illness is also critical. It is important to realize that medical professionals lean into more treatment. Doctors are trained to treat and cure sick people, so that it makes it hard for them when the things they do to make people better stop working well. It's important for patients to explain when they would prefer to stop treating every problem that comes up and refocus on a good quality of life. Patients can start by sharing their goals of care proactively. Some healthcare providers avoid bringing up these subjects with patients because they don't think it's the right time, or they might fear the patient will see this as a suggestion that the patient should give up on treatment. But when the patient or a concerned family member steps in to share information, it really helps the medical team understand what is most important and what the patient desires to gain from their care. Then medical providers can focus on treatment that matches what is important to the patient. There are multiple benefits to proactively communicating around goals of care and healthcare preferences when a person has a serious illness. First, these discussions give clarity about medical decision making. Patients and families gain a clearer understanding of the desired direction for medical care, making it easier to make decisions about critical moments. Second, they reduce the potential for stress and conflict. Families experience less stress and fewer conflicts when decisions align with clearly understood goals, and it reduces the burden of making difficult choices during medical crisis. Third, these discussions can add to the quality of care the patient receives. Healthcare providers can tailor treatments to the patient's goals, improving overall satisfaction with care and aligning interventions with what the patient values most. And finally, these discussions empower each patient's autonomy. Defining goals allow healthcare providers and family members to respect the patient's wishes, even if they become unable to communicate those wishes later on due to incapacity or illness. Now, let's take a minute to summarize why people should engage in advanced care planning and how you, as a community health worker, can encourage members of your community to think about this critical part of planning for the future. Advanced care planning is important because it allows individuals to make informed decisions or provide guidance about their future health care. It also helps ensure that their values, preferences, and wishes are honored if they are unable to communicate or make decisions for themselves. It tends to reduce stress and uncertainty for families and healthcare providers during a medical crisis, and it encourages healthcare providers to focus on care aligned with the patient's goals, especially in serious illness or end-of-life situations. Community health workers can play a key role in educating the public about advanced care planning. With your unique role in a community, you can raise awareness of the benefits of advanced care planning through outreach and workshops. You can provide culturally sensitive information about how to create advanced directives. You can facilitate important conversations between individuals, families, and healthcare providers about healthcare preferences, and you can help guide people in accessing resources and legal tools for documenting their decisions. In the remaining parts of this training program, you learn more about how community health workers can be a trusted resource in their communities and help more people take control of their future healthcare decisions. This video has built a foundation for understanding advanced care planning. In the next part of your training, you will learn more about tools like a living will, a power of attorney for health care, and how advanced directives documents can be crucial for ensuring that a person's medical preferences are followed even when they cannot speak for themselves.